that because it could be, I always ask, do you have low back pain when you're walking, when you're standing? Is different than when you have low back pain and you're just lying down. So we need to kind of figure out, what those limiters are, because that's actually going to help us. Is it a low tolerance thing, or is it an inflammatory or an irritability thing? Because that's actually what's going to help, identify what exactly it is that we need to do to those patients. So the tolerance anchors. So those are things that are usually somewhat related to longer duration types of activities. 80% of the workforce in the United States has to sit. And so that's a problem for someone who doesn't have a really good sitting tolerance, right? Walking is another one. We want people to walk. In fact, that's a challenge too, because it's usually something that we often recommend as part of our first line of, exercise therapy, or at least an ultimate goal as a result of that. And then we look at some of these other capacity things, which are more than just the day to day or the simplistic things, but being able to do a heel raise has an impact on your walking tolerance. Your sit to stand has an impact on your sit tolerance, as well as your low tolerance when you're standing up. And then we can look at some of these more quality ones, like some of the more advanced types of things. Maybe you're doing